What else can help with arthritis in the spine besides steroids? What I always recommend is, first and foremost, do conservative things. Wear and tear arthritis of the spine is a degenerative issue, an instability issue. So do the right kind of strengthening exercises, core and hip strengthening, optimize your weight, optimize your metabolic health, take the right kind of supplements. If it's not enough, then you talk about injection options. I generally do not recommend steroid injections for the spine. I think better options are things like prolotherapy and PRP, where you're treating the ligaments that have been chronically injured and loose, unstable. Improving that stability goes a long way to improving your pain with function. If there are arthritic facet joints, if there's a pinched nerve, you treat those with your own blood platelets as well, and that can help to reduce pain as well. I think you might mean prolotherapy or PRP can help it with herniated discs and fused discs. If you have fusion of the spine, it's not going to reverse that, but it can help to improve the instability there. Same thing with the herniated disc, so it can still help with pain and function for sure. Chantel, if you have hip osteoarthritis, it all comes down to severity. If it's advanced hip osteoarthritis and you have significant pain, restricted range of motion, usually hip replacement is the right thing. If range of motion is okay and hip arthritis is more like mild to moderate, then if you're failing physical therapy, then treatments like your own bone marrow concentrate stem cells or PRP can be helpful depending on the severity of your condition. Vanessa, absolutely. Tips for treating sciatica, right? Always. Number one is, again, optimize weight, optimize strengthening of the core and the hips. If it's not enough, then an injection can be helpful. If appropriate, depending on severity, PRP can be very helpful for that sciatica. User 405, torn Achilles, asking about platelet-rich plasma. It depends on the size of the tear. Are you talking about full thickness tear? Then that is surgical. I'm assuming that's not the case in your case. If it's a partial tear, then PRP is still a good option. Melissa, there's not really any medicine per se for osteoarthritis in the hip. I think it's more about deciding, do you have something that can be treated non-surgically, which is then exercise supplements like omega-3, curcumin, and glucosamine, and then regen med treatments like PRP or bone marrow concentrate, if appropriate. Brayton Rogers, thoughts on PRP? I've been utilizing PRP since 2008. I was such an early adopter when I first started utilizing PRP. The only people I could talk to were like maybe 3 or 4 medical physicians, and then a handful like veterinarians and dentists. Didn't know anything about this. But I think utilized for the right indication, in the right way, with the right physician, injecting properly, under image guidance, the right lab prep, I think it can be very helpful and a game changer for people who are living with chronic osteoarthritis, tendonitis, or back issues. A lot of hip issues that are being brought up. Lori, husband with ankylosing spondylitis, back hurts him a lot, he takes Humira. Question that his rheumatologist has to figure out is, does he have active AS or is it more wear and tear, chronic damage? If it's active AS, they may need to alter his regimen to something else. That happens sometimes. If it's more wear and tear damage, then besides the right strengthening exercises, treatments like prolotherapy and PRP can be helpful. Karen, epidural steroid injections for the spine, 70 years old. I think there's better options. The problem with epidural steroid injections, they're short acting, they don't treat instability. On top of that, they can thin out the bones. You're having frequent injections, that's a problem. You should look into something like platelet-rich plasma that is longer lasting, healthier for the body and the spine as well.